It's really great to be here today at CSAC with the full CSAC team to talk about something that really does link your organization and ours together. I'm here today to talk about First Five. I say First Five at 20, but of course we are 2 years out from that date. So the purpose of the webinar really today is to introduce some of the new thinking, some of the work that we're doing at First Fives across the state, to engage all of you in the work that we want to do together, and really to prepare for that moment, First Five, 2 years from now when we hit our 20th anniversary. We hope to be celebrating that with all of you on the webinar and our partners around the state. So with that, let me get to the slides. I have about 20 minutes of presentation, and then I hope we'll have a dialogue both with Farah and her colleagues and all of you on the webinar. Starting today, I have a slide in front of you, which some of you may have seen. It's a little bit dramatic if you haven't seen it before, and it shows that Prop 10 revenue has declined more than 30% since 2000. As you can see, the height of revenues were about $650 million in 2000, and we are projecting by the end of this decade to be at $300 million statewide. Now, while that seems like an ominous drop, I want to reframe our thinking about this and really ask the question about First Five funding: how little or how much is there? So as I just showed you, in 2020, Prop 10 will generate about $100 per child in California. Certainly not enough. However, in 1998, when the voters passed Proposition 10, we only generated twice that much, about $215 per child. So if we think about it from that perspective, it's really obvious that our work from the very beginning has been integration of First Five funding into broader county and public systems. I want to talk about how we work to increase that leveraging, increase that systems building over the next decades to come. Last year, First Five County Commissions invested nearly $500 million in early childhood systems efforts in the 3 areas that are required under the statute: health, family support, and early learning. While limited, the combined impact of First Fives is larger than the top 5 foundations' investments in California in children combined. So many of us often think, where does the future of First Five lie? And I want to say that the future, as you'll see in the slides to come, really does lie in working with all of you. So here's 2 quick slides just to show you where our money stands now. And these are very quick snapshots from the annual report data that our commissions provide each year to First Five California. We quickly analyze them, and you'll see an annual report to the legislature in January 2017. But these numbers have stayed fairly constant in terms of the proportions of our dollars invested in various areas across the state. The first pie chart on the left, I think, is a really important one as we think about the systems building impact of First Five. 65% of our revenues historically, including last year, has been reinvested in public agencies at the county level. This is primarily health and human services agencies, but also public education. So 65% of our dollars is immediately leveraged with the broader public systems in California. 35% of our funding goes to community-based organizations in every county in California. And those dollars are also very important because they build the integration of our funding into local networks, local systems of care, and really brings the diverse experience of neighborhoods, cities, and communities into the work of First Five. On the right, you see the pie chart that shows where our funding is spent. Historically, again, a little bit more than 1/3 of our dollars has been invested in preschool and childcare quality since 2000. But more than half of our dollars goes into the systems of care that I know CSAC members are so committed to, primarily family support and child health. 30%, this has changed a little bit over time, clearly with the passage of the Affordable Care Act. This has shrunk a little bit, and 23% in family support. The 11% in systems is money that's directly dedicated to professional development, training of the workforce, and other systems that keep our work together. So as funding declines, this is, of course, the #1 question. It's the reason we're on the webinar today, and it's the question that all 59 commissions, both the local commissions and First Five California, are considering right now. As our funding, as the decline really does take hold, and as we move from a situation where First Five did have significant reserves to a day where now most commissions do not have reserves, what does First Five do? I'm giving you here just one explanation of how commissions are thinking about it, but most of our commissions are in the strategic planning mode. We're really starting to think about the shift from direct services to systems, or as this slide suggests, instead of focusing on small numbers of families with direct services, thinking about the system scale and spread so that we are addressing problems, curing at the root rather than addressing the problem leaf by leaf. Embedded, of course, in First Five, for those who know our statute well, is that First Five is about prevention. So it's not surprising that our prevention focus, our systems focus, really does lead us to thinking about changing the systems of care and supporting the systems of care that support children 0 to 5 and their families. So that's a bit of an overview about where First Five has been, and now I want to talk a bit about where First Five is going. Systems building, a word that I've used a few times since we started, is truly at the heart of First Five. The statute, our First Five statute, calls for commissions to create integrated systems of care, for children 0 to 5. The statute does not say that our primary focus is direct services. Understanding that children 0 to 5 are unique, perhaps, in that no one solution is embedded in any one silo of our health and human services system. So a child can receive health care at the same place where family support may be provided to the mother, where child care agencies provide both early learning and health and social services all in the same place. Most of our services for children 0 to 5 and their families take place within a non-siloed context, within an embedded context. So I here have as well, for those of you who are new to Prop 10 potentially, the two goals of Prop 10 are really to innovate solutions to broad systems challenges, recognizing that in the late 90s there was a need to really think differently, along with all of our research about early brain development and the need to address children 0 to 3 in a way different than we do children 12 to 18, and really importantly convince others to bring our work to scale and spread. Again, going back to that $215 per child amount that the 50 cents tax on tobacco generated in 1998, or the $100 per child revenues that we expect in the next few years. Really, we have to be working in partnership with all of you and with legislators and the administration to really convince others to bring our work to scale and spread. Prop 10 funding simply alone will not achieve our ambitious goals, or any of our ambitious goals for children 0 to 5. Luckily, however, commissions now have on-the-ground experience and two decades of experience at the local level, trying out new programs, working with experts around the state and across the nation to developing innovative solutions. And as is evidenced by today's webinar, leaders, funders, and partners are really looking to First Five for statewide ideas and solutions. Let me talk about some of our systems work that we've done over the past 2 decades. I put at the top, I think, one that's really familiar to many in the CSAC world, our Healthy Kids programs, which were it was launched by First Five funding, first in Santa Clara, across the Bay Area, and then spread to counties up and down the state. This notion that we could go above and beyond the existing public health system to bring more children into programs. Also, on the family support side, recognizing that as good and as strong and as important as our child welfare programs are, prevention required a new approach to bringing families and children into a system of care. So our family resource center networks are the bulk of the 100 million that you saw in the earlier slide in our family support area, but really, again, up and down the state, systems of community-based organizations, public school districts, and other partners creating safe spaces for families to receive comprehensive services to address their needs and the needs of their children 0 to 5. Many of you on the webinar, no doubt, have been tracking the growing attention to quality investments in preschool, so quality rating and improvement programs in preschools and family childcare. We can think of those as direct services, direct workforce development, but really we need to think of those as a systems investment in California's system of early learning. The other piece that really is important to our systems work and our replication work across the state has been the focus on evidence-based model replication. When we started this work in 1998, there were relatively few tested models for supporting families, children 0 to 5, that were evidence-based. But over the last 2 decades, both here in California and across the nation, we have rolled out some evidence-based models that we know have real impact on the lives of children 0 to 5. I name a couple of them which are now well spread across California. Triple P, or the Positive Parenting Program, which not just First 5 investments, but for those of you who know, MHSA dollars are also invested in Triple P. Nurturing Parenting Program, another strong program. Our home visiting programs like Healthy Families America and Nurse Family Partnership. I'll talk more about those investments and those systems investments. And then in the area of early intervention, Help Me Grow, which is the only evidence-based model that spreads, that attempts to reach both children with special needs and children with moderate developmental delays. And then the third real area of our systems efforts that I want to draw attention to is our continued work in professional development and workforce development. A theme of our work over the last 2 decades has been that in order to address the needs of children 0 to 5, we had to train a new kind of workforce that was interdisciplinary, cross systems, and attending to the special needs of families with very young children. So I just highlight 2 here. One that is definitely something that counties are looking at, both for 0 to 5 and 0 to 18 children and their families, so trauma-informed care and mental health services and provider training, 2 areas where First 5s have worked hard to train not just their own programs, but providers across the system. So as you can see, I give this long laundry list of programs to show that really First 5 has, from the beginning, we can think about them as direct services, but if we think about their spread across the 58 counties and their relationship to county systems, you can see that really all of our investments have been systems efforts over the last 2 decades. However, as we've mentioned, the work that we've done to date does not bring us to scale and spread. Unfortunately, serving 1 million children a year or investing $500 million a year is not going to reach all children, even the at-risk children that we target so many of our programs at. So over the last 3 years, First 5 commissions across the state and working with our state partners in the state commission have really thought about what do we do beyond the 50-cent tobacco tax? How do we embed our programs more deeply into the systems that are being built across the state? So we've made a significant shift towards policy, towards capacity building, and towards communications, both at the association and at the local commission. We hope to be a more effective partner in working with all of you in talking about the needs of children 0 to 5. At the association, happy to say, working with Farah, we have increased legislative tracking and support. We are coalition building with other early childhood advocates, and we are engaging with key state departments, and I'll talk about some of that in the next few minutes on this webinar. And this is a new role for many First 5 commissions, and I note here, with many fearing backlash against moving from programs to systems. This is something I hear when I talk to commissions up and down the state, and as well to their grantees. As we move from direct services, as we have fewer dollars to spend, will we be less effective? And the message from our county partners, from our commissioners who are directors of health and human services, who are supervisors, who are superintendents of school, has been clear. Systems investments are needed and welcome. In many ways, folks outside First 5 and in other county departments have known this longer than we have, that it's not about the individual investment in a single program, but the way in which we ensure that those investments last beyond our years of investment and really change systems at the core. So I want to talk a bit about and engage all of us in thinking about where we go from here. So the association, again, 58 county commissions, 1 in every county, with commissions, over 500 commissioners, boards of supervisors members on every commission, directors of county departments on every commission, as well as early childhood experts, have helped advise the association in developing our policy goals. I don't have time to go through all of them today. I want to make sure we have time for questions, but I want to just focus on a few of them. You'll see that we have 4 key areas: family strengthening, early identification and intervention, oral health, and quality early learning. These 4 areas really represent the places where we know that there are the greatest opportunities to embed our services and the work that we've done into broader systems. Family strengthening, which we see as aligned to the broader child welfare agenda that all county departments are focused on, is really we want to see expansion to evidence-based family strengthening programs like the ones I mentioned earlier. We also think that child mental health awareness is a significant challenge, and we're excited, in fact, that we know that just in the next few weeks, the Mental Health Services Act oversight folks will be engaging in a new conversation about early childhood education and early childhood mental health. And of course, a strengthened social safety net for families that we work with. Early identification intervention means that we are focusing on ensuring that all children in California have access to the mandated developmental and behavioral screenings, which were the very first rollout of the Affordable Care Act. So most of our work in this area has been how do we take incipient efforts in counties to scale and embed them in the state's Medi-Cal system. Similarly, oral health. Many of our rural commissions were leaders in oral health investments beginning in the early 2000s, recognizing that there's simply not enough pediatric oral health providers available across the state. And luckily, as we'll talk about in the next slide, this has become an area of great interest in the Capitol as well, both at the administrative and legislative level, and we're excited that we have lots of movement in this area. And then, of course, quality early learning, which has been the bedrock for so many commissions, focusing on access, but also quality, ensuring that the spaces where our children are during much of the day are high quality, and that there is standardization to the ways that we support workers in the system. So you can see that we are focused on quality and access, systems and standards, and then, of course, compensation and stability of the workforce. Our final goal, which is down here at the bottom of the page, was in many ways where we started and spent the first decade of our advocacy work, simply to explore ways to ensure that First Five was a stable funding stream. We do not see assurance of our funding stream as much of a challenge anymore. I think that it's safe to say that counties understand the importance and the legislature understands the importance of First Five, but we need to think about how to expand other funding streams for the programs and services we care about. I want to highlight a few of our policy successes. Some of you have been involved in these, so I want to thank anyone on the webinar who has helped us do this work. And I think it gives an example for the readiness of our commissions to work with their county partners on both these policy efforts and other policy efforts at the local level. Again, I think the reason why we are so focused on statewide systems building is because we acknowledge that, well, we used to say, unfortunately, you've seen one county First Five, you've seen one. The truth is, you've seen one county First Five and you get a sense of the work that's happening across the state. So one of the most recent really strong achievements is that, as you know, California received one of the federal Race to the Top grants. And in California, that led to a 16-county effort to develop a quality rating and improvement system which creates quality standards for subsidized providers. That county effort is now statewide and has stable funding in the state budget through the Child Care Block Grant. So we know that this is something where 16 counties became a statewide movement. In oral health, last year, the Little Hoover Commission identified First Five as a bright spot in our system. And 13 First Fives have now submitted and are, I think, working on their clarifications for the Dental Transformation Initiative, part of the Medi-Cal 2020 waiver. These are joint efforts with departments of public health, clinics, and First Fives to expand and transform access to oral health. And we think this as a significant opportunity to partner with the state to bring to scale oral health efforts that have been sustained with Prop 10 dollars until now. I already mentioned our early identification work, and I want to just mention that this Help Me Grow effort is also replicated in other counties doing similar work to ensure that screening is matched by referral systems that connect children 0 to 5 to the services that they need when they have developmental delays. And now we are engaging with the Department of Healthcare Services. They have just launched a stakeholder effort that we're very excited about to understand how developmental screening really operates at the local level. So many of our commissions are now engaging with their health plans to understand exactly how this developmental screening effort is rolling out. I mentioned that our family strengthening work is still primarily programmatic, both in the areas of home visiting and parent education. We need to really develop clear policy asks that build on the data and outcomes and lessons of our 20-year experience, and we really know that we need to deepen our engagement with the child welfare system to bring our family strengthening work to scale across the state. So before we open to questions, I know there's one question that is on all of your minds, which is, so what is happening to Prop 10 funding? What happened last Tuesday? And is there good news for Prop 10 funding on the horizon? So here I have a bit of a wonky slide, which shows you all of the things that happened to Prop 10 funding in 2016. The first are really three significant and historic changes to the way that First Five revenues are collected. As you know, taxation, the Board of Equalization plays a huge role, and they are a major partner, of course, in our work. However, over the last, in the last decade or 8 years, there had been increasing encroachment of the BOE into Prop 10 funds to pay for expanded administrative costs for licensing. Two significant bills, ABX 211 and AB 270, both led by Assemblymember Nazarian from Los Angeles, really changed the dynamic between the Board of Equalization and First Five. One, the legislature acknowledged that there needed to be a licensing fee to cover the cost of enforcement, and this will be $4.6 million in savings to First Five in the current year. And AB 2770 says that the Board of Equalization cannot use Prop 10 funds for enforcement or administration moving forward. These are so significant. And in addition, the budget redirected a small portion of the BOE tobacco tax reserve back to special funds, including Prop 10. So this is really historic for us. It just shows that the legislature understands the importance of Prop 10 funds and really wants to make sure that we can preserve as much of them as we possibly can for services and systems on the ground. The two other pieces, of course, are the increase in the smoking age to 21, which will reduce Prop 10 revenues by at least $24.5 million annually. I wanted to stop for a moment and just pause on what it meant that 5% of our revenues were being generated by teenagers in California, and the notion that teenagers were paying for services for children 3 and 4 years old. So we, as First Five, celebrate the increase in the smoking age, and we actually applaud the legislature in doing this, and despite the fact that it reduces our revenues by 5%. Now, last Tuesday, as you know, we passed, the voters passed a $2 increase in the tobacco tax that included an e-cigarette tax. First Five receives none of the tobacco increase, but potentially $30 million as estimated by the LAO for e-cigarette revenues. So we know that there will be many discussions to come about what it will look like to apply an equivalent tax from tobacco products to e-cigarette revenues. We certainly have very few examples nationally that would help us understand what these revenues might look like, but we are very pleased that the sponsors of this proposition saw that that e-cigarette revenues were an appropriate way to generate additional funds for services for children and families in California. So when you put all of this together, negligible expected increase in Proposition 10 revenues from the tobacco tax, because those increased revenues really just balance out the drop in revenues for the increase in smoking age. And so we expect that the expected decline, as the Department of Finance estimates, will be continued to be, and that should be 3.5% per year. So our current estimates from the Department of Finance are 3.5% per year, and we expect that to continue. So the role for all of us, for County First Five Commissions, and I include everyone on this webinar today as part of our commission, since First Fives are have publicly appointed commissions, we have supervisors, we have county health, county directors, and of course we have experts across the state. We think of all of you as part of our First Five work. So the work of the county commissions is really the reason we're engaged in Sacramento. Legislators and administrative folks are very curious about the challenges and the opportunities that First Five brings, and we really want to work with all of you over the next few years to bring our work to scale and spread by looking together for funding for the programs and services we care about. And so our 400 plus county commissioners, I think, include many of you on the webinar today, and we look forward to working with you in the years ahead. I would like to just pose my own question to everyone before I turn back over to Farah. What are your current challenges, and how might First Five's family-focused and early childhood prevention efforts be additional assets to the work that you're doing? So as you work with families across with children from 0 to 24, and with parents, in every corner of the state, what kinds of things are you working on? I know trauma-informed care, father engagement efforts. These are things that you might not immediately think of as 0 to 5, but that we think of as very central to the work that we do. CalFresh enrollment via childcare and family resource centers, and of course cross-agency training. We think of that these are some of the ways that work that we're doing that you might not immediately think of as 0 to 5, but we'd love to work with you on all of these issues. My last slide is an optimistic one. I end this and I share this slide often with county commissions because it can feel very negative to think about the decline in our revenues. And we think, where do we go from here? But I want to suggest that California voters support public investment in voluntary universal preschool every time they've been asked. And this number grows and grows. And this is just the last spring's PPIC poll. But I want to suggest to all of us that our challenge is not simply to focus, to think about these very positive poll results as connected to universal preschool alone, but to really think about how we bring the same level of focus, systems thinking, and public engagement to support systems expansion for the entire 0 to 5 system of care. I think that the work is exciting. I think communities are engaged, and I know that our county partners and our First Fives have much work to do together. Thank you.
Thank you, Moira. Thank you. That was a lot of information and some very good slides. I do want to reiterate that the slides are currently available on the CSAC website at www.counties.org. And this webinar is being recorded, and the full presentation will be available at that same spot on the CSAC website in about 2 weeks. We do have a few questions here, so I'm going to start with the first one. How safe is First Five funding from state sweeps now?
What a wonderfully easy question to answer. I think First Five revenues are safe because we really have re-engaged with legislators and with state departments, and they understand the embedded nature of First Five. I think it was very important that First Five was available both at the local level and at the state level to be creative during the recession. But I think, first of all, our funds simply aren't big enough to sweep at this point. And I think our county partners truly understand how critical and important these programs are at the local level. So I think that our work is different. You'll see in our policy platform that we aren't focused on saving First Five, but on growing systems of care for children, 0 to 5.
Great, thank you. On to the next one. Can you talk a little bit more about the work in the area of trauma-informed care? What is that?
Great. So increasingly, we understand as there's research that actually comes out of the mid-1990s on adverse childhood experiences. And we have very good research that shows that children's earliest experiences at home, in the places where they spend their day, those experiences matter for a lifetime. So if a child that has strong attachment bonds, both with parents and caregivers, are set up for success in life. And unfortunately, we have too many children in California who do not have always positive experiences in childhood. In fact, one of the data points that we point out is that the most dangerous year of life is the first year in terms of child abuse and neglect rates in California. They're simply still too high. So when we look at adverse childhood experiences, we know that as we measure these, and there's certain ways that they are assessed and measured in adults and even young adults, that a person, an individual who's experienced 4 or more of these adverse experiences, that might be divorce, that might be abuse or neglect, attachment to, unsecure attachment to a parent or caregiver, that those can really cause challenges down the road, both in success in school and success in career and success in later attachments. So trauma-informed care is a new approach that really brings all of our systems together to think, how do we ensure that we are supporting all of our workforce and all of our families to recognize the needs of our youngest children? And how do we prepare our public employees, so folks on the front line, our healthcare providers, our teachers, our social workers, to be attuned to and able to support families that may be in crisis?
Great, thank you. We have our last question for the webinar today, which is, can you talk a little bit more about the changing role and context in light of the election and the potential repeal of the Affordable Care Act?
Wow. Luckily, I think I noticed that today in my email that there are at least 2 webinars. There's webinars aplenty in the weeks to come. What I can say right now is, along with all of our county partners, we are in a watch and wait mode. We love the statement from our legislative leadership last week that California will stay strong and protect and preserve programs for children and for families, and the Affordable Care Act is the bedrock of that. So I know that we will, First Five will be working with folks across California to ensure that we maintain that system of support for our children and families. So I think we are in a wait and watch mode, and First Five, and the reason we are engaged in policy is so that we can be there to support folks who will be working on this both at the state and federal level.
Great. Thank you so much, Moira.
Sure.
We can't thank you enough for traveling to Sacramento today to be here at CSAC and to present this to our members and others. We appreciate, I want to thank everybody for joining us today. A recording of the webinar and the slide presentation will be available again on our website, www.counties.org. The slide presentation is there currently. A recording of the full webinar will be there available within about 2 weeks. I also want to say that not only does CSAC appreciate Moira and the First Five Association working with us, but we look forward to working with them in the future, especially since next year will be very interesting for all of us.
Thank you.
So thanks again, Moira, and thank you for everybody for attending. Goodbye.